When you say punctuality, how do you mean? I understand the bureaucratic part of it, punctuality.
Sure.
What about
So,
that?
for instance, we would say, let's say we want to begin a surgery at 9 o'clock. In America, 9 o'clock means 9 o'clock. Everyone is in position by 8:55. I mean, and they're ready to go. That hasn't been the case when we've been on the continent, and we know that. And at 9 o'clock is when someone might be walking through the door who's key to get the room open, or like excuse me, but it's just the small things, and they add up, because instead of us being able to do, let's say, 5 surgeries when we're there, because we're there for 10 days, instead of doing 5 surgeries a day, we may be able to do only 2.5 or 3.
Right.
And we're not able to really make the most of these world-class doctors and physicians that take valuable time out of their clinic and practice to go down there. But there's only so much you can do, and none of it will be fixed overnight. So we recognize that, from the point of view of our colleagues there in Africa, that they have bigger problems to worry about, right? Than that.
Yeah.
So what may be a big deal to us, that may be the least of their worries. So it's a two-way street.
Okay. That's a perfect example, because I went through your social media handle. You did go to Cameroon in February.
Yes, sir.
And I saw that you had to bring in a lot of equipment. Some of the equipment on ground weren't good enough.
Correct.
How do you go about the logistics of, like shipping everything? Because I saw you had a whole lot of shipment as backup from America.
Correct.
That must have cost a fortune to do that.
Yeah, it's capital intensive. That's true. We really can't thank enough our volunteers. Really, it's not anything we do single-handedly. We just try to really organize and provide as much support as we can, but it requires so much effort on our end here. So before a mission happens, we do so much work. Like right now, like I'm telling you, in Ethiopia and Angola and the rest, we're planning for 2021 and 2022 missions, which requires us to get equipment, set it aside. We label each one, we put it in a box, and we sort it out based on the need of the country. But then again, it's a two-way street. We need our colleagues there to tell us, hey, what do you have? What are you lacking? Because if you already have a microscope in Ghana, and Nigeria doesn't have a microscope, or Cameroon doesn't have a microscope like we saw, it's better for us to ship that microscope to Cameroon. And sometimes it's difficult, because even if they have it, they'll tell you they don't have it. But we're very, very particular in the countries that we go. We always pick a country lead to help us. So we always go down there. We visit with the physicians, and we pick one or two that we feel will help us organize everything, that are have the same mindset as we do, and then we collaborate with that colleague to make sure that they then develop everything on the ground. So, for instance, in Ghana, Dr. Totime is a great example. He's the head of neurosurgery in the capital at Ridge Hospital. So he told us point blank, we don't have this, we don't have that. Great. He also organizes to see the patients before we get there. So before we went to Ghana, 2 years ago, we had all these patients that he had seen, and he sends all their x-rays, all their MRIs, everything about the patient to our secure platform. And we are able to assess each patient and say, okay, they need surgery, they need physical therapy, they need this. And we're able to comb through all those patients and make surgical decisions ahead of time. So that allows us to know what equipment to ship. Because when you're doing, for instance, a back surgery or a knee surgery, there are so many little details that you require, or else the surgery just can't happen. And we don't want to go there and disappoint anyone. So we want to plan as meticulously as possible. But the items that we get here in the U.S. are stuff that we gather. We have great partnerships with the hospitals that we work with here, and they've been very, very kind to us. They donate as much as they can, and then we buy some supplies as well. And then we get donations from abroad. In Cameroon, we had donations from Switzerland, and we had a few items from Germany when we went to Ghana as well. So all that helps.
Oh, fantastic. Fantastic. So the next question was going to be, how do you intend to solve some of these challenges? But you've touched on them. But I've got specific things to talk about, some of the things you just said. So when you, what you do is you gather, okay, for instance, let me ask you a question. When you went to Cameroon, how many medical doctors, what was your team like? How many people did you have to fly out there? How many operations were you able to do? And is it just surgeries you do, or what healthcare do you provide or help people in need with?
Sure. Yes, that's a great question. So in Cameroon, we had 30 volunteers and doctors. 19 of them were doctors, and then we have volunteers that help everything go. They're key, obviously, for logistical help, for planning. So the doctors arrived, and they had different specialties. So we had foot and ankle, we had brain surgery, we had spine surgery, orthopedic surgery, podiatry, OB-GYN, and many more, cardiology. So the goal was then to see patients, to see as many patients as possible, and then triage them for surgery. Cameroon was challenging in that, the normal pattern that I described, which is working with our country lead and having patients already ready for surgery, it was not possible with Cameroon because of a few other items. Go ahead.
Okay. Yeah, I mean that's a good one. The next thing I would like to discuss. So, can you hear me?
Yes, I can hear you.
Okay, I'm just gonna place this thing back. I have to let people know who we're talking to and what the whole conversation is all about. Okay. What are your projections for the next 5 to 10 years, and how far do you want to take this great movement to?
Oh, thank you. So, in Cameroon, for instance, we were able to do, we were able to see over 1,500 patients, and we were able to do at least, I want to say, intervention-wise, almost 100 or so interventions, from dental surgery to brain surgery to spine and the rest. So in the next 5 to 10 years, we want to be able to repeat and enhance that in each country we go. We want to be able to get more supplies so that we can do more. As you probably saw on our social media, there were a couple of surgeries we weren't able to do because of lack of resources there. And it really still pains us till this day. Our staff, we all still talk about it. So our goal is to be able to, have multiple concurrent missions going at the same time, or at least have a mission every single month in different countries in Africa, which will require a lot of capital, to buy the equipment and supplies. But I think it's very doable, to be honest. We're a wealthy continent, and we also have a wealthy diaspora, and we also have really, really caring partners. The other countries want to help. The U.S., the European countries, we have a lot of people, volunteers, and just organizations that want to help, and we just want to get the story out there of what we're doing, get as much support as possible. And my dream is to be able to step back and see the organization on par with UNICEF, if hopefully not bigger, or some of the larger organizations. And then it will just be a smile to see an organization that have such a deep African connection, deep African roots.
Brilliant. I mean, back in the day, a couple of people that Nigerians can testify to that. There is the University College Hospital, UCH, in Ibadan. The sound is muffling up. What are you placing your phone on? Are you placing it on like a laptop or something?
Can you come again? The question.
So your phone, are you holding it or you're placing it on a laptop? Because I think the sound is bouncing off something.
Oh, really? I'm holding it.
Okay. Okay, I just thought I'll ask because that's what somebody suggested might be happening. University College Hospital is in Ibadan, in Oyo
Yes.
State. Is usually it should be about 30, 40 minutes drive from Lagos, but because of the bad road, you could spend hours to get to Ibadan from Lagos. But it was one of the best in the world. I think it was top 3 or top 5 at some point.
Correct.
Arabians and a lot of people used to come back then. But right now, it's deteriorated to the state where people are not so confident in the system, And this is not just for Africa. This is not just for Nigeria alone. We are all of the African countries as well. They have, similar issues and similar problems. So my question is, it's a very, very good thing and inspiring thing that you're doing. But how do you think we can start to evolve in the healthcare system of African nations, whereby we can have a sustainable and reliable medical system? Because it's so appalling. The people that are in power that are supposed to do these things, nothing gets done. But like you said, sorry, let me just finish this point. Now, in the pandemic where nobody can move from point A to point B, it's really exposed a lot of, inconsistency and a lot of, bad leadership within governments in Africa. How is there a pathway for us to begin to engage and have these conversations? And do you think by, what ways can we engage, just make it better? Do we work with healthcare professionals? Is it the government that we need to hold accountable first? What are your thoughts on that?
Yes, great point. I think there are multiple ways to approach this. Like I told you, we were contemplating this issue years ago, and we decided that we would not be heard unless we took action, right? And that's the whole genesis of the Brain Project, is that we could talk until the cows come home about the change that needs to happen in Africa, but we can't really hold those accountable that are responsible for, improving the state of healthcare if we ourselves don't do something about it, especially those of us of African descent who are in the healthcare field. We have no excuses. So we decided to take action, and that's the first solution. I invite everybody, all my colleagues, everyone in any healthcare sector to come and join us. They can contribute in so many ways because we are the only ones that are going to be able to change the state of healthcare in Africa. It is, it's sad, but it's not it's not on the top of the table of things that they care about right now until this pandemic came around, because basic food, basic things in Africa are not there. And, these politicians, they have to deal with those circumstances to get elected. But healthcare should be like the number one thing that we care about, because without healthcare, we're not a country, we're not a nation or a continent. So I think the best way to approach this is those in the diaspora, including us who are young enough. We need to go back. We need to pitch in and do whatever we can. And that's why we put a lot of emphasis on Africans who are living in diaspora to join us and help us go back and make that change. We welcome all our friends. We have a lot of volunteers, a lot of my friends who are European or from the West that join. And trust me, we really need everybody's help. But when it comes to Africans, I think I'm extra strict on Africans that they need to really go back. We have no excuse. I mean, you look at you. We met in December at Ghana at Christmas. And the way we met, if you think about it, if you hadn't got on a plane and made that journey, from the UK to Lagos, from Lagos to Accra, you didn't have to come to Accra, but you took that trip, and we have to do that. We have to make that move, or else nothing will happen, or this meeting doesn't happen,
Absolutely spot on. You're very correct there. I feel that people get, as individuals, we get caught up with day-to-day life activities, and sometimes a lot of us have actually not prioritized well, in terms of our actions or what we do. Because I feel giving back is one of the greatest things you can do as a human being to be fulfilled. Because everything you do in life is about risk. When you go out, you can work, you come back, you get on the bus, whatever you're doing, you're eating. So with the time you have, the different ways you can reach out and help out. Some people don't have money to give. It's not about money all the time. And I think as Africans, a lot of the times people don't understand that you have to you have to have a mindset of how you can improve things and what you can do to help maybe the next generation, or even to help yourself.
Correct.
Because people who are living in diaspora, they have plans to go back home. But by the time they go back home, they were supposed to have helped out in one way or the other. They haven't done that. They find themselves running back here or wherever in the world after a couple of years because the system is not sustainable.
Exactly.
And in place for them. I'll use an example of one of the fields I'm into, in football. You have a lot of footballers in Africa, they make a lot of money, sports people. While they're playing abroad, they're not thinking of how they can empower the upcoming generation. They're not thinking about how they can even help themselves, how they can invest back home, whether in whatever shape, form, or way. And then all of a sudden, their career has a dip. And in most times, the Africans have to go back home. And then they have to start climbing up the ladder again. And it becomes so difficult because there's no structure in place. They haven't invested in a system that they benefited from, whether it was a good system or not. But once you get up there, you have to be able to do something. So I think you have to change the narrative like you guys are doing. I have to go back to you guys again. It's a thing, it's a conversation we have to keep having, and it affects all spectrum of African society.
Yeah.
Sports, healthcare, politics, whatever it is, we have to get involved, and we have to. And I feel that most times we don't tell our stories, and this is where we get it wrong. So other people come and tell stories.
Exactly.
People go on social media, they start fighting. But, you didn't do this. But why don't you tell the story?
Yep.
Another example, like you look at Fela and Nikolako Kuti. For decades, Fela was fighting for human rights in Africa, in Nigeria, through his songs. What people just saw was, this guy smokes weed. They didn't pay attention to the music. They never pay attention to anything he was saying or doing. But the man is dead now. He's left a legacy. And everything he said in his music is now coming to pass. And guess what? Right in the middle of all that, you start hearing about Fela now. Africans are not the ones telling the stories. If you do your research, you find out the people that behind the machine that put in the Fela agenda is the heart, the music, and they're making millions of dollars on it. As Africans, we haven't done that.
Correct.
The other thing now is Afrobeat is gaining enormous popularity, but there's no structure in place.
Correct.
For Africans' benefit, And these are things that a lot of people have fought for, to push to the prime, to let people be aware of the culture of Africa, of different aspects of African life. But the key thing that you guys are doing that I'm really, really happy about is that you're telling a story. Now it's left for some of us that have, the expertise and have the zeal to push out the agenda, because you guys have come together, you're spending your money, you're spending your time, you're spending your resources, you're risking your lives to do all this great thing for Africans. So we have to keep telling the story. And I hope that, you keep pushing the agenda forward, and I'm not the one to tell you what to do because you're already doing a fantastic job. But whatever help you need, you can always reach out.
Thank you.
Because we have to take this You have to spread this word. There's so many organizations around the world, but for me, this is the first time I'll actually see a group of physicians that leave their base all over the world and go to Africa, and they're doing it on a large scale. There's some other people do it, but you guys are doing it on a large scale, and like things I've seen, it just gives me courage that there's still hope. There's hope.
I agree.
Yeah.
I agree. No, thank you so much for that. And you make really great points. Like, for instance, I'm fortunate that we have friends. I have cousins that are younger than me that are in medicine, that are getting out of residency now. We have, we have, we have such a rich culture and a wealth of knowledge. And it would be sad, if we don't continue that, right? It will be really sad if we have all of these resources, but we don't put it to use. And then one day we turn around and someone else comes and tells a story of how they revived African healthcare. And that's what we tell, like, everyone that I run into. I think I've beaten the drum so much. Can you imagine someone going rescuing African healthcare, and you as an African healthcare professional, you were sitting there? What were you doing? What would you tell your kids, your grandkids at the time? And you mentioned Fela and those that came before us. They were so proud, and they did so much. And now their legacy lives on forever. It is sad that others are profiting from it and not the children of Africa, but it will change. At least it's a step in the right direction. So I think we have to tell our own story, or else we have no right to be mad when others tell it for us. And you hit the nail right on the head. That's why I support anything that Afro Nation was doing. I mean, we were there in December. You see what an enormous event, and the core, right? Those are two African guys that have that idea, and they've manifested it. And hopefully they saw that in us too, and that's why we had the partnership in December. And there are so many great minds out there, African minds, that are just not being, and this, with all due respect to everybody else, it's not to put down any other culture. It's just that I think Africa has been subdued for so long, and it's sad. And it's about time that everyone needs to excel. We need to seek excellence. And in our family, or at least in our culture, we know that that's what we expect. An African parent expects you to be an engineer, a doctor, a lawyer. And so now that we've done the work, we've put up with the constant talk from our parents. We need to go back and give back and show what we've learned.